my name is Chloe, and today I'm going to be talking to you about asthma and specifically the physiology of asthma. So asthma is a disease that causes chronic inflammation of the airways, which in turn causes shortness of breath and makes it super hard to breathe. A patient experiencing asthma would have some common symptoms such as shortness of breath, chest tightness, wheezing, and even coughing. The coughing usually would occur first thing in the morning or later on at night. To understand asthma, you really need to understand the physiology behind it and how the airways and the lungs really work. Asthma is a common disease that most of us have heard of or know someone with it, but until you really get into the physiology of it, you won't understand exactly how it works. So to learn more about this, I turned to the National Heart, Lung, and Blood Institute, and on there I learned that our airways carry air into and out of our lungs. But when they become inflamed, the muscles around them tighten, and then it causes the narrowing and it allows less air to go into the lungs. Sometimes tying a photo with it helps me, so I pulled up a photo here from MichiganRC.org, and that's really a good way to show patients how everything works. So here's the lungs right here, and then here's our bronchus and our alveoli, and then this is what the enlarged alveoli looks like. So whenever this gets inflamed and these muscles tighten, it makes it super hard for air to flow into the lungs. So that's a little bit more about the physiology behind it. And as for diagnosing this disease and treating it, that's where it gets a little bit tricky. So for diagnosing it, usually according to the American Academy of Asthma and Immunology, asthma is usually diagnosed by performing a series of breathing tests. You would maybe breathe into an instrument, and that would kind of regulate how well your lungs are working. And as far as treatment, asthma is usually treated by medications. Commonly, we know of an inhaler. My dad suffered from severe asthma when he was younger, and he actually even had to get shots for it. But overall, asthma has no cure. So it's a long-term disease that people live with that they just have to learn how to treat it, but there's no cure for asthma.